Welcome back to my YouTube channel. The Centers for Disease Control and Prevention estimates that about 15% of people in the United States are living with chronic kidney disease. And because this can be a silent disease with no symptoms until the condition becomes severe, up to 90% are not aware of it. Harnessing 8 Powerful Ingredients for Better Kidney Health. Join us as we uncover the flavorful journey toward vitality and wellness. If you want the spice route to lower creatinine, these 8 extraordinary ingredients are beneficial to you. The number 1 is the most important. Before delving into the details, make sure to watch till the end, and don't forget to subscribe to my channel for more videos like this. Why does creatinine matter? Creatinine, a waste product, is filtered by the kidneys. Elevated levels in the blood may indicate kidney issues. Healthcare providers monitor creatinine through urine and blood tests, considering various factors. Symptoms like urinary changes, muscle cramps, and fatigue may prompt testing. Conditions such as diabetes, hypertension, and infections may necessitate regular evaluation. Temporary spikes can result from exercise, certain medications, pregnancy, or diets high in red meat. Addressing underlying causes is crucial for managing creatinine levels and kidney health. Here are 6 natural methods to reduce your creatinine levels. Number 8. Reduce your protein intake. Studies have indicated that consuming high quantities of protein can lead to a temporary elevation in creatinine levels. Particularly, the process of cooking red meat converts creatine into creatinine, impacting its levels in the body. Individuals who consume diets high in red meat or other protein-rich foods, such as dairy products, may experience increased creatinine levels compared to those with lower consumption. To mitigate this effect, consider shifting towards a more plant-based diet. Instead of beef burgers, opt for vegetable patties, hearty vegetable stew, or lentil soup as alternatives. Number 7. Don't take supplements containing creatine. The influences of dietary fiber on creatinine levels. Nonetheless, one research study revealed notable declines in creatinine levels among individuals with chronic kidney disease who augmented their fiber intake. A variety of foods contain dietary fiber, including fruits, vegetables, whole grains, and legumes. Research revealed that the consumption of creatine ethyl ester resulted in a nearly 3-fold rise in serum creatinine levels, with only a slight increase in serum creatine. Conversely, ingestion of creatine monohydrate led to a notable increase in serum creatine levels and only a minimal elevation in serum creatinine. Lower your salt intake. Consuming diets high in salt can contribute to elevated blood pressure levels. Processed foods, in particular, tend to contain high amounts of sodium and phosphorus, which research has linked to potential kidney complications. Opting for whole, unprocessed foods and incorporating spices and herbs for flavoring can be a healthier alternative. Consistently consuming high amounts of salt can elevate your risk of developing severe kidney conditions, as well as heart disease and stroke. Studies suggest that rock salt, commonly referred to as senda namak, is often recommended for individuals dealing with kidney disease. Number 5. Avoid overusing NSAIDs. Taking over-the-counter pain relievers, such as non-steroidal anti-inflammatory drugs, NSAIDs, beyond the recommended dosage or too frequently can pose risks, particularly for individuals with kidney disease. Consult with your healthcare provider to identify suitable pain and inflammation management strategies, as well as the appropriate frequency for their use. The use of NSAIDs poses a risk for contrast media-induced nephropathy, CIN, typically characterized by a relative rise in serum creatinine of 25% or a decline in GFR by 25% within 24-72 hours following exposure to contrast media. This complication is frequently observed in high-risk individuals, including those with chronic kidney disease, CKD, and diabetes mellitus. Number 4. Avoid smoking. Cigarette smoking can adversely affect the body in various ways, notably by substantially elevating the risk of chronic kidney disease. choosing to quit smoking presents an opportunity to mitigate the likelihood of kidney-related complications that could lead to elevated creatinine levels. In the general populace, individuals who smoke do not show reduced creatinine clearance compared to those who have never smoked. Surprisingly, current male smokers tend to have slightly higher creatinine clearance rates, even when considering normotensive and hypertensive groups separately. However, this variance is minor, particularly among women. Number 3. Consult your healthcare provider regarding your optimal fluid intake. Dehydration may elevate creatinine levels, and fluid intake could pose challenges for individuals with kidney disease. Discuss with your healthcare provider the recommended daily water and fluid intake, including the optimal timing for consumption. Dehydration can result in an increase in serum creatinine levels and a corresponding decrease in the estimated glomerular filtration rate, eGFR. The extent of these changes typically correlates with the severity of dehydration. Severe dehydration may even prompt acute kidney injury, potentially necessitating dialysis therapy. Creatinine, a waste product, can accumulate in the bloodstream due to kidney disease and other causes. Maintaining proper hydration, implementing dietary adjustments, and considering supplements can aid in reducing creatinine levels in the body. This waste product is naturally produced by muscles. Number 2, eat more fiber. Further research is necessary to fully understand the impact of dietary fiber on creatinine levels. However, one study demonstrated noteworthy decreases in creatinine levels among individuals with chronic kidney disease who enhanced their fiber intake. Fiber is present in a variety of foods, such as fruits, vegetables, whole grains, and legumes. While there is limited clinical evidence regarding the impact of diet on kidney function in DKD patients, findings from clinical trials suggest that supplementing with fiber can lower blood urea and creatinine levels and enhance eGFR in CKD patients. To effectively reduce creatinine levels, it's advisable to decrease the consumption of red meat and fish, and instead incorporate a high-fiber diet comprising fruits, vegetables, and whole grains. Opt for antioxidant-rich fruits, such as cranberries, kiwi, apples, and blueberries, to aid in lowering creatinine levels. Number 1. Limit your alcohol intake. The impact of alcohol consumption on kidney function can be complex. Some research suggests that moderate alcohol intake may lower the risk of chronic kidney disease. Conversely, excessive alcohol consumption has been linked to kidney damage and can exacerbate conditions such as high blood pressure and alcohol dependence. If you consume alcohol, it's important to discuss with your healthcare provider to determine the safest levels based on your individual health requirements. Phosphocreatine constitutes 2/3 of creatine and is primarily stored in muscles. Conversely, alcohol exerts adverse effects on muscles. Engaging in physical activity shortly after alcohol consumption can lead to muscle damage and hinder the recovery process. Therefore, consuming alcohol may counteract some of the muscle-building advantages associated with creatine. Which ingredient listed in The Spice Route to Lower Creatinine, Harnessing 8 Powerful Ingredients for Better Kidney Health? Do you consider the most significant for reducing creatinine levels? Please leave your answer in the comment box. Don't forget to like, share, and subscribe so you never miss any updates. Till then, stay happy and healthy.